If you're dealing with cavity pain right now, I need to be crystal clear. These are not cures. A cavity will only get worse without professional dental treatment. These hacks are about managing pain until you can see a dentist, which you absolutely must do as soon as possible. Let's start with cold water. Take a sip of ice. Cold water and hold it in your mouth near the painful tooth for 30 seconds. The cold numbs the nerve temporarily. When the pain returns, repeat the process. Some people find switching between cold and room temperature water works even better. Clove oil contains eugenol, a natural anesthetic. Never apply it pure because it burns. Dilute 2 or 3 drops in a teaspoon of olive oil. Soak a cotton ball, squeeze out excess, and place it against the affected tooth for 20 minutes. Do this 3 to 4 times a day. If you don't have clove oil, use a whole clove. Place it near the tooth and gently bite down to release the oils. Salt water rinses reduce inflammation. Mix half a teaspoon of salt in 8 ounces of warm water. Swish for 30 seconds, reaching the painful area. Spit and repeat 2 or 3 times. Do this after meals and before bed. It cleans food particles from the cavity and creates an environment less hospitable to bacteria. Garlic contains allicin with powerful antibacterial properties. Crush a clove, let it sit 10 minutes, mix with a pinch of salt, and apply directly to the tooth. Avoid your gums because it's irritating. Leave it 5 to 10 minutes, then rinse. The taste is intense, but many people swear by it. Peppermint tea bags contain menthol with mild numbing properties. Steep a tea bag, let it cool to warm, and hold it against the tooth for 20 minutes, or refrigerate it and use cold for numbing. The tannins may also reduce swelling. Hydrogen peroxide kills bacteria. Mix equal parts 3% hydrogen peroxide with water. Swish for 30 seconds without swallowing. Spit and rinse thoroughly with plain water. Do this once or twice daily maximum. Vanilla extract contains alcohol that acts as a temporary anesthetic. Dab it on a cotton ball and apply to the tooth for a few minutes. Use real vanilla extract, not imitation. Reapply as needed. Avoid extremely hot or cold foods. Skip sugar completely because it feeds cavity bacteria. Avoid acidic foods and anything hard or crunchy. Stick to soft foods like mashed potatoes, yogurt, and soup. Chew on the opposite side of your mouth. Elevating your head while sleeping can significantly reduce nighttime pain. When you lie flat, blood rushes to your head and increases pressure in your tooth, which amplifies the pain. Sleep with 2 or 3 pillows propping you up, or use a wedge pillow if you have one. This keeps your head elevated above your heart and reduces that painful throbbing sensation that tends to get worse at night. Over-the-counter pain relievers are your friends right now. Ibuprofen is particularly effective for dental pain because it reduces inflammation as well as pain. Take it according to the package directions, usually 200 to 400 milligrams every 6 to 8 hours. If you can't take ibuprofen, acetaminophen works too, though it doesn't reduce inflammation. Never apply aspirin directly to your tooth or gums. This is an old myth that doesn't work and can actually burn your gum tissue. Take the pain reliever orally with water. If one type isn't working well enough, you can alternate between ibuprofen and acetaminophen, taking one every 3 hours so you're never taking them at the same time. But check with a pharmacist first to make sure this is safe for you. Benzocaine gels are available over the counter at any pharmacy. These are topical anesthetics that numb the area temporarily. Products like Oragel or Anbesol contain benzocaine. Apply a small amount directly to the tooth and surrounding gum according to the package directions. The numbing effect kicks in within minutes and can last for several hours. Don't overuse these products and don't use them on children under 2 years old. Here's something most people don't think about. Stress makes pain worse. When you're stressed, your body produces cortisol and other hormones that can actually amplify pain signals. Try to stay as calm as possible. Practice deep breathing. Inhale slowly through your nose for a count of 4, hold for 4, exhale through your mouth for 4, and pause for 4 before repeating. Do this for 5 to 10 minutes whenever the pain is particularly bad. Distraction helps too. Watch a movie, listen to music, play a video game, anything that takes your mind off the pain. Boil pulling is an ancient Ayurvedic practice that some people find helpful. Take a tablespoon of coconut oil and swish it around in your mouth for 15 to 20 minutes. Yes, that's a long time. The oil pulls bacteria and toxins from your mouth. After 20 minutes, spit it out into a trash can, not your sink because the oil can clog pipes. Then rinse your mouth with warm water and brush your teeth. Do this once a day, preferably in the morning before eating. Some people report significant pain reduction, though the scientific evidence is mixed. Acupressure might sound alternative, but there's a specific pressure point that's connected to tooth pain. It's located on the back of your hand in the webbing between your thumb and index finger. Apply firm pressure to this spot with your opposite thumb for 4 to 5 minutes. Press hard enough that you feel it, but not so hard that it's unbearable. This is based on traditional Chinese medicine principles, and while the mechanism isn't fully understood, many people report that it helps reduce dental pain. Now let's talk about what not to do, because this is just as important. Don't ignore the pain and hope it goes away. It won't. Cavities only get worse. The bacteria will continue eating away at your tooth, and the cavity will get deeper until it reaches the nerve, at which point you're looking at a root canal or extraction instead of a simple filling. Don't try to dig out the cavity yourself with a toothpick or any other object. You'll cause more damage and probably introduce more bacteria. Don't use numbing gels excessively. They provide temporary relief but can mask worsening symptoms. Don't drink alcohol to numb the pain. It dehydrates you and can interact badly with pain medications. And please, don't cancel or postpone your dental appointment thinking these remedies are enough. They're not. Let me address the financial concern because I know that's often why people delay seeing a dentist. Yes, dental work is expensive, but here's the brutal truth. Delaying treatment always makes it more expensive. A filling might cost you a few $100s. A root canal costs several times more. An extraction and implant can cost thousands. Many dental offices offer payment plans. Dental schools offer reduced-cost treatment performed by supervised students. Community health centers often have sliding-scale fees based on income. Some cities have free dental clinics for people in financial hardship. The pain you're in right now is your tooth screaming at you that something is seriously wrong. Listen to it. If you experience certain symptoms, you need emergency dental care immediately, not tomorrow, not next week, right now. If you have severe swelling in your face or neck, if you have difficulty breathing or swallowing, if you have a fever above 101 degrees, if you have severe pain that doesn't respond to any pain medication, or if you notice pus draining from around the tooth, these are signs of a serious infection that can spread to other parts of your body. Dental infections can be life-threatening. They can spread to your jaw, your sinuses, your brain, or your bloodstream. People have died from untreated dental infections. This isn't meant to scare you unnecessarily, but you need to understand the stakes. While you're managing the pain with these temporary remedies, keep the area as clean as possible. Brush gently around the affected tooth with a soft, bristled toothbrush. Don't avoid brushing the area completely, because bacteria will accumulate and make things worse. Use a gentle, circular motion. If brushing causes too much pain, at least rinse frequently with warm salt water to keep the area clean. Floss carefully around the tooth to remove any trapped. Here's a remedy that combines several approaches. Make a paste with turmeric powder, salt, and mustard oil. Turmeric contains curcumin, which has anti-inflammatory and antibacterial properties. Mix half a teaspoon of turmeric powder with a pinch of salt and enough mustard oil to make a thick paste. Apply this directly to the affected tooth and surrounding gum. Leave it for 10 minutes, then rinse thoroughly. The turmeric will temporarily stain your teeth yellow, but it washes off. Do this once or twice a day. Wheatgrass juice is rich in chlorophyll and has natural antibacterial properties. You can either drink it or use it as a mouthwash. If using it as a mouthwash, swish it around for a few minutes, making sure it contacts the painful area. Wheatgrass is thought to absorb toxins from the gums and reduce bacterial growth. It's not as commonly used as the other remedies, but some people find it helpful. Guava leaves have been used in traditional medicine for various purposes, including oral health. If you have access to fresh guava leaves, chew 1 or 2 leaves slowly, allowing the juice to work around the painful tooth. Alternatively, boil 4 or 5 guava leaves in water for about 5 minutes, let it cool to a comfortable temperature, add a pinch of salt, and use it as a mouthwash. The leaves contain antimicrobial and anti-inflammatory compounds. Thyme is another herb with powerful antibacterial properties, thanks to a compound called thymol. You can make a thyme mouthwash by adding a few drops of thyme essential oil to a glass of water and using it as a rinse. Or make thyme tea by steeping fresh or dried thyme in boiling water, letting it cool, and using it as a mouthwash. You can also soak a cotton ball in thyme oil diluted with a carrier oil and apply it to the affected area. One more thing about pain management at night. Sometimes the pain gets so bad that you can't sleep at all, which makes everything worse because exhaustion lowers your pain tolerance. If over-the-counter pain relievers aren't cutting it, try combining multiple methods. Take your ibuprofen, use a clove oil application, rinse with salt water, apply a cold compress to the outside of your cheek, elevate your head, and practice deep breathing. The combination of approaches often works better than any single method. Throughout all of this, remember that you're not alone in dealing with this pain. Tooth pain is one of the most intense types of pain the human body can experience because teeth are highly innervated. The nerve endings in your teeth are incredibly dense, which is why cavity pain can be so overwhelming and all-consuming. It's not in your head. It's not something you should just tough out. It's real, it's valid, and it deserves treatment. Make that dental appointment, call first thing in the morning. Explain that you're in significant pain and ask if they have any emergency openings. Many dental offices reserve slots for urgent cases. If your regular dentist can't see you quickly, look for urgent dental care clinics. They exist specifically for situations like yours. When you call, be honest about your pain level. Don't downplay it. The more clearly you communicate your distress, the more likely they are to fit you in quickly. Until you can get professional treatment, rotate through these remedies. Use cold water for immediate relief. Apply clove oil for longer-lasting pain reduction. Rinse with salt water after every meal. Take your pain medications on schedule. Keep your head elevated. Avoid pain triggers. Stay hydrated with lukewarm water. Most importantly, be kind to yourself. This is temporary. With professional treatment, you'll be pain-free soon, but you have to take that step and make the appointment. Your future self will thank you for it.